When the emergency room doctor looked at my ultrasound results and then back at me with eyes full of something I can only describe as horror, I knew my life had just split into before and after. "Mrs. Chen, you have significant internal scarring and adhesions consistent with." "I'm sorry, but it appears you experienced a complete uterine rupture." "When did this happen?" 3 months ago." I wanted to scream. 3 months ago, when I was begging them to listen, when I told them something was catastrophically wrong, when I screamed that the pain wasn't normal and they kept telling me I was hysterical, overreacting, being dramatic. 3 months of bleeding that wouldn't stop, of pain that made me pass out, of knowing in my bones that my body was destroyed while doctor after doctor patted my hand and prescribed anxiety medication. The ultrasound image on the screen showed the truth my body had been screaming all along: a uterine rupture so severe that my chances of ever carrying another child were gone, and the emergency hysterectomy I'd need was just a matter of when, not if. I'd been terrified of this pregnancy from the moment I saw those 2 lines. My first baby, Michael, had been born via emergency C-section after a grueling 30-hour labor that ended with fetal distress. The incision had healed well, the doctors assured me, and when I got pregnant again 2 years later, I was told I was a perfect candidate for a VBAC, vaginal birth after cesarean. I researched obsessively, read every study, joined online support groups, and interviewed 5 different practices before finding Dr. Reynolds, who seemed supportive and knowledgeable about VBAC protocols. "Your scar is strong," she told me at 20 weeks, running her fingers over my lower abdomen. "You're healthy, your baby is healthy, and you're an excellent candidate. You're healthy, your baby is healthy, and you're an excellent candidate. We'll monitor you closely." I created a birth plan that emphasized the warning signs of uterine rupture, sudden severe pain, abnormal fetal heart rate, vaginal bleeding, and made sure everyone on my care team knew my history. I thought I was being responsible, prepared, informed. I walked into Riverside Hospital for my scheduled induction at 39 weeks believing that my previous C-section scar was my only risk factor. I had no idea that the real danger would be the medical staff who stopped seeing me as a person the moment I started expressing fear. Labor started slowly with cervidil, then progressed to Pitocin when my cervix wouldn't dilate past 3 centimeters. I remember feeling uneasy about the Pitocin. I'd read that it increased rupture risk in VBAC patients, but when I asked about it, the resident waved away my concern. "We use it all the time with VBAC patients. You'll be fine." The contractions came hard and fast, artificial waves of pain that felt different from my first labor, sharper somehow, more violent. By hour 6, I was dilated to 5 centimeters, but the pain was becoming unbearable in a way that felt wrong. Not labor pain, something else, something deeper and more frightening. I kept pressing the call button, telling the nurses that the pain between contractions wasn't going away, that something felt fundamentally wrong in my abdomen. "That's just back labor, honey," one nurse said, barely looking up from her computer. "Try changing positions." But I knew the difference between contraction pain and the constant, burning agony that was building in my lower abdomen. Looking back now, I can see that the moment I started questioning them was the moment they stopped listening to me. The pain escalated over the next 2 hours until I was sobbing, begging for help, trying to explain that this wasn't normal labor pain. My husband kept pressing the call button, kept demanding someone examine me, kept saying something is really wrong with my wife. The nurses started getting annoyed, their voices taking on that edge of irritation that told me they decided I was being difficult. At one point, I heard a nurse outside my door say to another, "The dramatic one in room 7 is calling again. Can you deal with her? I can't take the screaming." I wasn't being dramatic, I was experiencing a medical emergency that was destroying my uterus from the inside while they rolled their eyes at my terror. When Dr. Reynolds finally came in around hour 8, I was thrashing in bed despite the epidural, clutching my abdomen and screaming that something was tearing inside me. She checked the fetal monitor, which showed my baby's heart rate was fine, and barely examined me before saying, "You're just experiencing intense labor. This is normal for VBAC. You need to calm down and breathe through it." I looked at her through my tears and said as clearly as I could, "Please, I think my uterus is rupturing. Please check. Something is tearing." She actually laughed, a small, dismissive sound that I will never forget. "If your uterus was rupturing, the baby would be in distress. The monitors show everything is fine. You're catastrophizing. But I wasn't catastrophizing. My uterus was actively tearing apart, the old C-section scar giving way under the relentless artificial contractions, my internal organs beginning to herniate through the opening, blood pooling in my abdomen. And nobody would believe me because the fetal heart monitor looked normal and I had a history of anxiety documented in my chart from my first traumatic birth. I learned later that uterine rupture doesn't always show immediate fetal distress, that there's sometimes a window where the mother is the only one who knows something is catastrophically wrong. But in that window, I was just the hysterical woman who couldn't handle normal labor pain, the anxious patient who read too much on the internet, the difficult case that nurses complained about in the hallway. My husband demanded they do an ultrasound, demanded they check me more thoroughly, but Dr. Reynolds was already leaving. I have other patients. You're progressing normally. I'll check you again in 2 hours. Those 2 hours would cost me my fertility, my health, and nearly my life. Somewhere around hour 10, the pain changed. It went from unbearable to something beyond pain, a tearing, ripping sensation so visceral that I started vomiting. I felt something give way inside me, felt a pop and then a rush of wrong that made every nerve in my body scream danger. The baby's heart rate finally started dropping, and suddenly the room was full of people. But even then, even with alarms going off, Dr. Reynolds was saying, fetal distress, we need to do an emergency C-section, not uterine rupture. They rushed me to the OR, my husband running alongside the gurney, and I remember screaming, I told you something was wrong, I told you, over and over, while they put me under general anesthesia. When I woke up 3 hours later, my baby was in the NICU but alive, and I was told I'd had complications during delivery. Nobody used the words uterine rupture. Nobody apologized. Nobody acknowledged that I'd been right. The days after delivery were a nightmare of confusion and agony. I was bleeding heavily, soaking through pads every hour, but when I told the nurses they said it was normal postpartum bleeding. I was running a fever, but they said that was normal too. The pain in my abdomen was so severe I couldn't sit up, couldn't walk, couldn't hold my baby without screaming, but they kept saying C-section recovery was hard and I needed to push through it. My discharge papers said emergency cesarean section due to fetal distress, patient recovering well. There was no mention of rupture, no mention of the complications I'd experienced, no acknowledgement that anything unusual had happened. When I asked Dr. Reynolds directly what had gone wrong, she squeezed my hand and said, sometimes labor just doesn't go as planned. The important thing is you and baby are healthy. But I wasn't healthy. I could feel it in every cell of my body, something was profoundly, catastrophically wrong. They sent me home on day 3 with pain medication and instructions to follow up in 6 weeks. I lasted 5 days at home before the pain became so unbearable that I couldn't stand. I was bleeding through multiple pads an hour, running a fever of 103, and experiencing pain so severe that I passed out on my bathroom floor. My husband found me unconscious and called 911, and I woke up in a different hospital's emergency room with doctors frantically running tests. That's when I learned the truth, that my uterus had completely ruptured during labor, that the tear had extended through my entire lower uterine segment, that I'd been walking around for over a week with internal bleeding and a massive infection because nobody at Riverside Hospital had properly diagnosed or documented what happened. The ER doctor looked at me with tears in his eyes and said, "I'm so sorry. This should never have happened. When did they tell you about the rupture?" They never did. They'd stitched me up, sent me home, and hoped I wouldn't figure it out. The emergency surgery that followed was extensive. They had to remove infected tissue, repair multiple internal organs that had been damaged, and address the hemorrhaging that had been slowly killing me. The surgeon told me later that if I'd waited even 12 more hours to come to the ER, I likely would have died from sepsis. My uterus was so damaged that they couldn't repair it. Hysterectomy was the only option, performed emergency style while my husband sat in a waiting room with our newborn son and our 2-year-old, trying to explain why mommy might not come home. I was 28 years old and my childbearing years were over because a doctor had ignored my screams, because nurses had dismissed my terror as dramatics, because a hospital had covered up a catastrophic complication rather than providing appropriate care. I spent 2 weeks in the hospital recovering from the hysterectomy and infection. During that time, I requested my medical records from Riverside Hospital, and what I found made me physically sick. The nursing notes documented that I'd been complaining of pain and expressing anxiety, but there was no documentation of my specific reports about tearing sensations, about constant abdominal pain between contractions, about my repeated requests for evaluation. Dr. Reynolds's notes claimed she'd thoroughly assessed the patient and found no concerning signs. The operative report from my emergency C-section mentioned discovering the uterine rupture but framed it as if it had just happened, not as something that had been progressing for hours while I begged for help. There was no incident report, no documentation that staff had been informed of a serious complication, nothing that acknowledged they'd missed a life-threatening emergency despite my explicit warnings. What I found instead was a narrative carefully constructed to protect the hospital and Dr. Reynolds, a story where the rupture was sudden and unpreventable rather than a slow catastrophe I'd been reporting for hours. My lawyer told me that uterine rupture cases are incredibly difficult because hospitals almost always claim the rupture happened suddenly during delivery, making it impossible to prevent. But I had witnesses, my husband, my doula who'd been on video chat, who could testify that I'd been reporting specific rupture symptoms for hours before the emergency. I had my own voice on video, recorded by my doula who'd been documenting my VBAC attempt, literally screaming something is tearing inside me, please help me, I think my uterus is rupturing, while staff ignored me. I had text messages my husband had sent his mother during my labor, they keep saying she's fine but something is really wrong. They won't listen to her. But even with all that evidence, my lawyer warned me that medical malpractice juries are reluctant to rule against doctors, especially in obstetrics where outcomes can be unpredictable. The fact that they didn't properly document the rupture works against us, he explained. They'll say the documentation issues were clerical errors, not cover-ups. I live with the consequences of their negligence every single day. I had to have 3 additional surgeries to address complications from the emergency hysterectomy and the infection that ravaged my body. I have permanent nerve damage in my abdomen that causes chronic pain. I have severe adhesions that make simple activities like bending or lifting painful. I deal with surgical menopause at 28, with all the hot flashes, mood swings, and bone density concerns that come with it. I grieve the loss of my fertility, the children I'll never carry, the experience of pregnancy that was stolen from me. My marriage has been tested in ways I never imagined. My husband carries guilt for not protecting me, for not demanding more forcefully that someone listen, even though the failure was never his. My relationship with my body is shattered. I look at my scars and feel rage at the system that did this to me. But I've also become an advocate, and that work gives me purpose when the grief threatens to consume me. I speak at medical conferences about patient advocacy and the danger of dismissing women's pain. I've connected with dozens of other VBAC rupture survivors, and our stories are horrifyingly similar: hours of reporting symptoms, being told we're overreacting, discovering later that we were right all along. I've learned that the VBAC rupture rate is low, around 0.5 to 1%, but that the warning signs are well documented in medical literature. I've learned that continuous fetal monitoring doesn't always catch rupture early, that maternal symptoms are often the first and most reliable indicator. I've learned that pitocin significantly increases rupture risk and should be used cautiously if at all in VBAC patients. I've learned that there's a culture in obstetrics of dismissing laboring women's concerns as anxiety or pain intolerance, especially for patients with any mental health history. I've learned that hospitals routinely alter records and avoid proper documentation of complications to protect themselves from litigation. I teach pregnant women preparing for VBAC about the specific phrases that should trigger immediate evaluation. I feel tearing. The pain isn't stopping between contractions. Something feels wrong in my abdomen. I tell them to demand ultrasound evaluation if they report these symptoms, to refuse to be dismissed as anxious or dramatic, to have their support person advocate loudly and repeatedly.